Good evening. For the first time in months, Governor Holcomb joined state health leaders today for an update on the COVID spread across Indiana. And simply put, things aren't looking great. They explained why. Hospitalizations are reaching record highs. The Omicron variant is spreading rapidly. So tonight, our big story tackles the best ways to protect yourself against this newest strain. The anti-COVID treatments arriving in Indiana this week, plus the plans in the works for schools as quarantine rules change right before the spring semester.
There was a lot to unpack from Wednesday's COVID update from the governor and state health leaders. Here are the top 3 takeaways for you and your family. The Omicron variant is here. The first case discovered just 11 days ago. Delta is still the dominant variant in COVID cases in Indiana, but that's expected to shift quickly because of how contagious Omicron is shaping up to be. Even those who are fully vaccinated and have their booster can still spread Omicron, even if they show no symptoms.
As the Omicron variant sweeps across the U.S., it is more important than ever that people use the tools available to reduce the spread of COVID-19. We have those tools in ample supply: masks, hand hygiene, staying home if you're sick and getting vaccinated and boosted.
The state's getting in more therapeutics to treat COVID, but in limited supply. The antiviral drug from Merck that just got emergency use authorization from the FDA treats mild to moderate COVID-19 symptoms in people 18 and older. To get it, you need to be at high risk of serious illness and get a doctor's prescription. Almost 5,000 courses arrived Thursday at select CVS and Walmarts across the state. Pfizer's antiviral pills are available for high-risk patients 12 years and older. Just over 1,000 treatments went to hospitals across the state. They, too, are in short supply. And a monoclonal antibody treatment from AstraZeneca went to transplant centers and will soon be available at cancer centers. This treatment is for patients 12 and older who don't have an immune response to the COVID vaccine. Right now, it's also in limited supply, with 960 doses being delivered this week.
There is simply not enough medicine to go around right now, and do not bank on being able to get a therapeutic when you need it. It will take time to increase supplies and distribute these treatments, and none of them are 100% effective. Vaccination remains our #1 defense of preventing severe illness.
Finally, when it comes to your kids heading back to school in 2022, there's no official new guidance on quarantining from the CDC. The state will hold a webinar Thursday with school nurses and local health departments to determine what could come next with the impending surge because of the highly contagious Omicron variant. But state health officials say cases in school-age children are at the highest level they've seen in months. We'll be following that webinar Thursday, and we'll let you know how it could affect your kids heading back to school in the new year.
And we'll be watching closely. Emily, thank you. Today, Governor Holcomb also responded to skepticism from Indiana's Attorney General and fellow Republican Todd Rokita about the state's COVID numbers. During an interview earlier this month, Rokita said he didn't believe the numbers when it comes to the pandemic, claiming the situation is politicized. Well, today, the governor called those comments demoralizing. He said the AG is welcome to look at the numbers, ask questions, and report any issues to the Inspector General.
It's quite serious when you accuse or insinuate anyone of inflating numbers. In my book, that's called fraud. And if there is a shred of evidence, he or others need to take that to the Inspector General of the state of Indiana.
Shortly after the governor said that, the Attorney General issued a written response saying this isn't about fraud, it's about inaccurate numbers and political agendas causing doubt. You can read his full response at WTHR.com. And that wraps up tonight's big story.